It's a pleasure to welcome Dr. Callie Blackford Winders to Maryville College to speak about her journey in veterinary medicine. She attended Maryville College between 2009 and 2012 and graduated in 2019. She was a valedictorian of the University of Tennessee College of Veterinary Medicine class of 2016, and then went to the University of Georgia to finish her small animal medicine and surgery internship. In 2020, she completed her small animal surgery residency at the University of Minnesota and won multiple awards, including first place outstanding surgical resident 2 years in a row. She owns Blackford Veterinary Surgery Referral in Knoxville, Tennessee, where she performs orthopedic and minimally invasive surgery with a special interest in arthroscopic and laparoscopic procedures. And now I'm going to give the floor over to Callie.
Hi guys, thank you so much for having me here. Like she said, I'm Callie, and I'm going to kind of walk you through the path that I took through veterinary medicine. A little bit different than some people. There's a bunch of different ways you can go in vet med, but I think the things that I want you guys to take away from this is all the ways that I got very lucky along the way, and I hope that that can help you find your luck too. So let's start with where I am today. I am currently the owner of Blackford Veterinary Surgery Referral. It is a surgery specialty practice in Knoxville. So all we do all day, every day is small animal surgery. And it's me and two other surgeons. And we have this nice building that I'll talk to you guys a little bit more about. I also am a consultant for arthroscopic vet systems. And that means that I travel around the country and I have the opportunity to teach different people how to do arthroscopic surgery. Now, if you ask most veterinarians where they thought they would be when they were 8, they would all say, I wanted to be a veterinarian from the time I could walk. And that absolutely was not me in any way. If you asked me where I would be when I was 8, I would say this: I'd be in outer space. And I was very serious. I wanted to be an astronaut very, very badly. I loved science, I loved exploring, and I loved learning new things. And so I was very set on that. And I'll say the first place I got lucky along the way is I had parents who loved me and cared for me and wanted me to be realistic. My dad said, Callie, God made you beautiful, God made you smart, but God made you with asthma. And they do not send people with asthma into outer space. And so if you want to be an astronaut, that's great. You will be staying on planet Earth. And I said, nope, that is not for me. I'm going to be an orthopedic surgeon. And that is a huge change in what I thought I was going to be based on where I was when I was 8. And I think that I had a little bit of help getting there because both of my parents are surgeons, but they are veterinary surgeons. So my mom is a small animal veterinary surgeon and my dad is an equine surgeon. And I spent most of my life hearing, oh, are you going to be a vet like your mom and dad? And I said, no, I am not going to be like my mom and dad. I'm going to be a real doctor. So I came to Maryville College in about 12 years ago, which makes me feel very old. And at Maryville College, I studied biology as my path to going to medical school. And I was a cheerleader and very much enjoyed my time doing that. And crazy thing, I met a boy at Maryville College who I am still with today. So I think that my second huge stroke of luck in my career path was coming to Maryville College. And I will say that because I gained some enormous skills here that I had no clue at the time that I would need and that I thought I would never use, but they completely changed the trajectory of what I'm doing today. So I will say the first thing about Maryville, and you guys are all here and know this, Maryville College is hard. Maryville College is a lot harder than going to a state school. And because of that, I had to learn to study effectively, efficiently, how to retain information, and how to use each class to build on the other class. And you guys are going through that right now. And I will say that because I learned how to do all that as a college student, it made vet school in comparison easy to being at Maryville College. And that should make you guys feel very good, not very scared, very good. By the time I got through Maryville, I knew what I needed to do, and compared to the way I had to learn at Maryville, the way I retained stuff at vet school was easy. Second thing that I think was a huge bonus was, as part of the curriculum at Maryville, you learn how to critically read and evaluate scientific literature and how to properly research and write scientifically. And that was incorporated into tons of the classes at Maryville. I don't know if any of you guys are in biochem right now and have done the bioinformatics project. I don't know if that's still a thing, but I think that was a huge step in the direction that I went as far as my research goes. Because after you get out of college, you're kind of expected to know that. It's not something that they walk you through and hold your hand through when you're going through higher education, unless you're in the research specific field, and I am not. So that was something that really, really changed my path, and I'll talk about that a little bit more later. The next thing is the liberal arts education, and this is something I 1000% did not appreciate enough when I was at Maryville. I thought, oh, we're taking all these extra classes. I'm never going to use this, and I could not have been more wrong. I learned how to public speak. I learned about business. I learned about communication and things that I never thought I would use and that I use every single day of my career now. And it's definitely nothing that they taught me in vet school. So having a well-rounded education is really, really important, and learning how to be a lifelong learner is really important because you don't know where you're going to be, even if you think you know where you're going to be. And I certainly thought I knew I was going to be a doctor just doing surgery. So during my sophomore year at Maryville College, I decided that it was time for me to get some experience in a medical setting because I'm going to be a doctor one day. And so I got a job at Blackford Memorial Hospital, which is very conveniently located. And I was super excited to start my path going up through the medical career. And I learned very, very quickly that being a doctor was not for me. And it wasn't because of Blackford Memorial, it was just because people are suited to different careers, and that was not what I was suited for. So getting this job was absolutely pivotal in the formation of what my career would be. And so that would be my next spot of luck. I was so lucky that I decided to get experience in the field that I thought I was going to be in early, because I very well could have gone through a very expensive and prolonged education and got out on the other side and realized, holy cow, I do not want to be a doctor. So that's my next piece of advice for you guys is if you guys have a profession in mind, go get experience now. Don't waste your time. Don't think, I know I want to do this. You're silly if you think that I'm going to change my mind, because it made a huge difference for me. And after 5 short months working at Blackford Memorial, I came home and said, I am not going to be a doctor. I'm going to be a veterinarian. And at that time I was a junior and I applied for vet school. And at that part of Maryville's career, there was not a 3+1 program. So I got into vet school, and when all of my friends and my husband were graduating college, I did not graduate college. I had started my first year at UT. And that was a little bit hard, but I finally graduated from UT in 2016. And after that, they developed the 3+1 program with the vet school at UT. And I finally graduated from Maryville College in 2019 after I was already a doctor. So that was a little funny. Following my graduation from vet school, when you're becoming a specialist in veterinary medicine, I knew that when I went into vet school, I still wanted to be a surgeon. So my career path changed a bit, but I did want to be a surgeon. So following your 4 years of vet school, you're expected to do an internship, potentially a surgical internship and a residency in order to become a surgeon. And so I was very lucky to get my top choice internship at the University of Georgia. And I would say it was lucky because I got to go where I wanted to go. I had a very, very good internship experience in education, but the #1 reason I got lucky is by meeting this gentleman. And this is Dr. Sam Franklin. And at the time that I was at Georgia, he was the lead researcher and head orthopedic surgeon at the University of Georgia. And I did not know that when I started there because I did not adequately research. So I guess that's my next tip is when you are going along your path, figure out who can help you along the way. So the way I got lucky is I heard him talking about a knee surgery in the hallway, and I said, oh, are you an orthopedic surgeon? I want to be an orthopedic surgeon one day. And I knew that research was an important part of that pathway, just from hearing people talk about it. I had 0 research experience at that time and told him that I was very interested in getting some research experience under my belt. And he told me, okay, Callie, I have a really great idea for a project that I think you can do in this 1 year that you're an intern. There's a surgeon in California who is starting to do a normal procedure that we do, but in a different way. So I think that we should kind of explore this procedure and do a project on it, but I don't have any funding. So go write a grant. I was like, a grant? How do you write a grant? No one's ever told me how to write a grant. And so I looked back on my bioinformatics project and all of the different lab reports and things that I had written at Maryville. And I was like, I know how to write scientifically. Let me just take a peek at some grants. And so I looked up grants and kind of how they're written. And I wrote my first grant proposal, and he spent an hour editing it, and we submitted it. And I got very lucky once again, and I got granted $12,000 to do my internship research project. That would not have been possible at all if I had not gone to Maryville College and learned how to do that. So I used that $12,000 to do this project. So this image is a dog's femur, and there are a bunch of different problems that can happen in the hip. Hip dysplasia, hip fractures, and hip luxations. And there is a very good hip surgery that can be done, but most people can't afford that hip surgery. So this is the secondary option for hip surgery in dogs. It's called an FHNE, so it means femoral head and neck excision. And most doctors perform the femoral head and neck excision from a craniodorsal approach, so kind of over the back. And the goal of the surgery is to remove all the bone there that's in red. So the landmarks for that are the greater trochanter, which is the, which is the bigger part of the bone right here, and you cut all the way down to the lesser trochanter. Well, from the craniolateral approach to the hip, you can only see the greater trochanter, and you cannot see the lesser trochanter. So you're kind of doing it a little bit by feel. And there's a surgeon in California that had been kind of talking about, hey, why do we do it that way? If you go from the ventral approach, which is more inside the groin, you can see the lesser trochanter, and that's the most important area to get to the bone in. And on top of that, when you remove that part of the bone, they form a false joint, and the only thing that's holding their leg kind of in place is the muscles on top of the hip. So you've got some gluteal muscles and your joint capsule, and when you disrupt all of that, the hip moves up in relation to the body, so their leg is actually a little bit shorter on that side than the other side. And if you do it from this approach, you're not disrupting any of those muscles. There are some downsides of doing it from this way. It's a little bit scarier in anatomy. You have some really big vessels down there. But my mentor was like, hey, you're just an intern. You've never done surgery before at all. So if you can do this, why can't surgeons do it? So our grant, allowed me to take 10 cadaver dogs, and on one hip I would do the standard approach, and on the other hip I would do the tested approach. And I put all those dogs through a CT scanner, and I had to learn how to use a volumetric analysis program on a computer, which I definitely never learned before, and measure how much residual volume was left that I wish I could have taken out, or measure if I took out too much bone. And by the end of my internship, I had that project completed. And by the very beginning of my residency, I had that project submitted for publication. So next stroke of luck is where I found my residency. The residency and internship matching program is all done on a computer, and you essentially put your application in and you say, okay, I will tolerate going to any of these different institutions. And by tolerate, I mean, please give me a residency, because the majority of people don't match. I think there's a 30% match rate each year, and most of the people that do match have done multiple internships prior to getting a residency. And I was one of the very incredibly lucky ones. I matched on my first try. It was not to my top choice place, it was to my ninth choice place. And when I found out I was moving to Minnesota, I cried. I thought, I do not want to go live in the Great White North. That's not even the United States, that's Canada. And I do not want to be there. And I could not have been more wrong. I absolutely love the University of Minnesota. And this was my next huge stroke of luck. I got put somewhere I didn't want to go, but that place had a huge value of research, presenting your research, and going to continuing education to fill in any of the gaps that they couldn't fill. most residency programs did not let their residents go anywhere but stay in the building that they had matched to. And my residency program was very, very supportive of research. So even though I had done my research at my internship, they allowed me to submit that research for going to different conferences to present it. And so I won the Veterinary Arthrology Advancement Association Resident Research Award and the ACVS Surgery Summit, which is the American College of Veterinary Surgeons in Maine meeting, as a first-year resident with my project that I did not even do at my residency. And you can imagine that after a little bit of success, you get very excited about doing research. And that really opened doors to me. I went into vet school thinking, all I want to do is knee surgery. I'm going to be a knee surgeon, and that is it. I don't need to do any of this extra stuff. I don't care about research. And I was very, very wrong. Research was a huge, huge part of what led me to where I am today. So given my success with my internship project, I got matched with this guy, who is my next huge stroke of luck. This is Dr. Mike Conzenius. He is probably one of the best published and well-researched veterinary orthopedic surgeons in the country. He became my mentor at Minnesota, and it was a very unlikely match for a mentor. Dr. Conzenius has a little bit of a reputation of being rough around the edges and kind of opinionated and a bit gruff. And I am clearly not very much like that. So it took him a little bit to get to understand my communication style, and I had to learn his communication style. And it ended up being an amazing partnership because he had experience in things that I didn't have. His background was in biomechanical engineering and developing new techniques for surgery, mostly implants. He actually developed one of the implant systems to do total elbow replacements in dogs. And that is something that I didn't know anything about. And he liked the fact that I had already done my publication. In your residency program for surgery, you are required to have one publication prior to finishing your residency. And I was very lucky because I came in with that publication already done. And so that allowed me to do a little bit of a risky project, meaning this project could be something really, really, really cool, but it might fail. It might not end up with me being able to do anything with it. And so he said, Callie, I have a great idea. I want you to develop a new way to do knee surgery. So this surgery is called a trochleoplasty, and the trochleoplasty is used for dogs that have kneecap problems. Patellar luxation is what most of these dogs, these little dogs get, where their kneecap slides from its normal place in the groove of your knee to the inside of the knee. And one of the surgeries that we do for that is called a trochleoplasty. And in that surgery, we essentially save the cartilage, but we take little hand saws and cut a V of cartilage out, set that cartilage aside, and then deepen that groove with another saw, and then put the cartilage back in the groove in order to get a deeper groove for the kneecap to sit in. And there are a few different techniques for this. The majority of surgeons use one of these two techniques. So there's a wedge trochleoplasty, it looks kind of like a taco, or there's a block trochleoplasty where you cut it parallel. The block trochleoplasty has been recognized as the better procedure because it maintains the depth of the groove for a longer period of space compared to the wedge, because the wedge tapers at the top. The wedge is substantially easier to do than the block. So even though we know the block is better, on a 5-pound dog, sometimes you do what you can do when their bone is this big. So he said, I think that we can do better than this. This is all done by hand. This is tedious. This requires multiple revisions in order to get everything to fit together well. Why wouldn't you just make a tool that does it for you? I was like, yeah, that's what you think. Just make a tool. And he said, I don't really know how to do this, but I'm thinking maybe that a hole saw would work pretty well. And of course I had to Google what a hole saw was. This is a hole saw. It saws holes in doors. And I thought, I don't know how that's going to work, but I'll work on it. And he said, oh, by the way, we don't have any funding. And so I started out on my project to A, design an instrument to do this, and B, get some funding to do this. And by golly, did the whole saw work, and did my first idea to make this work as a group work. Yes, next stroke of luck. I just thought maybe we just make a guide for it. So essentially what I did is I made little teeny tiny hole saws. I had a engineer make those for me, and put them on a drill, which is what we use all the time in surgery. And then I designed these little guides, which is a little plastic piece there. The big thing with the hole saw is it goes in a circular motion. And if you just tried to hold the hole saw up to the knee, it would just walk right off the knee. So I was like, well, all we have to do is keep it on the knee. And I made a little guide that you put a pin through the bone to hold it still, and then kind of hold the guide on there. And this is a video of one of our first cases that we did. And essentially it's the same steps of doing it with the hand techniques, except for it's all kind of done with the one instrument. So you make your first cut. This feels like slow motion because I do it significantly faster than this now. The whole process maybe takes 5 minutes in total. And you take your first cut with the saw blade, and that piece of cartilage stays inside the saw blade. And you go down to the next size smaller saw blade and drop your little guide down and cut deeper bone. And then you put the cartilage piece back, and it just worked, which was, again, very lucky. But given that I figured out what we were going to use very quickly, it gave me more time to write a grant proposal and use all those skills that I had gained. Went back and was given $10,000 to do this project. And so for this project, I did surgery on 10 patients. We did the block, which is the gold standard, on one knee, and the skirt, which is what we named this, the semi-cylindrical recession trochleoplasty. And I named it the skirt because it was really funny to have such a gruff, big, scary surgeon say skirt all the time. And then it stuck. He was not happy about that. But I did the skirt on one knee and the block on the other knee. All these dogs had disease in both of their knees. And we did pressure platform analysis. So they make these big pressure mats that measure how much pressure the dog is putting on each foot as they walk. So we walked the dogs over the mats. We did the surgery. We walked them over the mats 8 weeks later, took x-rays. Took CT scans right after surgery so we could see how the pieces all fit together, how deep were we able to get them, and compared them. We found no difference as far as how the dogs did. There was no difference in complications, no difference in lameness, and they did equivalently well. The skirt is easier to do than the block, and I thought that the really interesting thing we found was you're making the block by hand, and so all this is done with your eyeballing it and kind of making adjustments by hand. And when you have instruments that are designed to fit perfectly together, the piece sits down in the groove perfectly with the skirt, and there are imperfections in how the piece fits when you use a block. So I took that project and submitted it to present at the American College of Veterinary Surgeons meeting, and won first place Outstanding Surgical Resident Award in the clinical division. And this was huge. It was very fun and exciting to do that, and it opened more doors for me. So I was then invited to present it at the orthopedics meeting, and it won the orthopedics meeting. And then, if you remember, the first talk I ever gave was at the Veterinary Arthrology Advancement Association meeting. What I didn't mention is that the surgeon from California that had been talking about the hip procedure is actually the head of the Veterinary Arthrology Advancement Association meeting. And when he had heard that I had done this project for knees, he said, Callie, I really need you to come back. I want you to speak at our next meeting as an invited lecturer. At that time, I had not even passed my boards, and I got to go lecture to a bunch of boarded surgeons, which was a huge opportunity and absolutely not what I expected to do with my life. I thought I was just going to do knee surgery all day long and never do anything else. This also opened up another door. Arthrex Vet Systems is the main corporate sponsor of the Veterinary Arthrology Association, and they have a teaching division where they go across the country and teach vet residents, veterinarians and vet surgeons how to do arthroscopy. And this past year, I became a consultant. So they invited me to be one of the teachers of all these courses, of which I took several when I was a resident. And that was not expected. I thought maybe I would get to do that later on in life, but because of all these doors that were open from meeting all these people and doing all these things that I didn't expect to do, I have a different career than I thought I would have. So my daily life now, this is Blackford Veterinary Surgery Referral. My mom started this practice, so she's a small animal surgeon, and I bought it from her. And in the midst of buying it from her, we changed it. I wish I had a picture of the original building because we just did an enormous renovation on this. So we went from having one operating room to having 3 operating rooms and having just surgery to now having room for a lot more. These are 2 of our operating rooms, and I wish I could compare some pictures because our old operating room looked like a closet. I think I do have one in here. And here it is. Here's us in the closet, and here's me in my new minimally invasive OR. So I have an operating room that looks like Grey's Anatomy now. It's pretty cool. There's screens coming down for me to do all my arthroscopy surgery. I also do laparoscopy, which I never thought I would do that because it wasn't in my wheelhouse, and it's something I learned along the way. And I have goals for the future. So aside from being a business owner, I want to take this practice from being just a surgery practice to a multi-specialty practice. So we have built a rehab area, and these pipes in the floor are actually for underwater treadmills that are getting installed here in a couple of weeks. We have a full rehab service available with underwater treadmills, laser, ultrasound, therapy, things that I don't know anything about, but I am smart enough to hire somebody who knows something about. So we're opening our rehab service this year, and we have a goal of hiring other specialties like cardiology or ophthalmology, internal medicine, and growing our practice. Along with my husband, who's a Maryville College grad, he's going to be doing more of the business part of that, but certainly I have to make business decisions, which is not something that I thought I would be doing. So going from wanting to be an astronaut at 8 to wanting to be an orthopedic surgeon until I was 20 years old, to becoming an orthopedic surgeon, but not the kind that I thought I would be. And even from there, that is not what I ended up doing. I'm not just an orthopedic surgeon. I'm a researcher. I'm a lecturer. I'm a teacher. And I'm a business owner. And I truly don't think that I could have done all of that if I hadn't gained the skills that I gained that I didn't even know I needed. So I hope you guys take this. Oh, and an entrepreneur. I hope you guys take this and get more out of what you're doing. I know it's hard when you're stuck in the moment, but it really is amazing to get the kind of education you guys are getting here. The other thing I would like to say is make sure you have some fun along the way. My favorite things to do are travel and see all of God's beautiful places. This is actually a picture in Oregon from going to a veterinary conference that I went and saw the Oregon coast, which was beautiful. And I chased around my little 2-year-old with the silly boy that I met at Maryville College, and I ride horses. So I do have an invited guest here if he wants to come up. He is not one of my personal patients, but he's one of my mom's patients. I think the big thing I want you guys to take away from this is not everybody can do everything. And I certainly cannot do everything. And Koba, right? Has a hip problem, and so I can do the FHNE surgery that I talked to you guys about, but there is a better surgery called a total hip replacement. And she came to see my mom when she was younger, and her hips were very bad. And my mom, knowing that there are people that can do things in a better way, sent her to get her total hip replacement done at the Ohio State University. So we all work together and collaborate in veterinary medicine, and there are people that are really good at one thing and not really good in another thing. And I think all of us want the best thing that we can have for our patients. So I was glad to have a Maryville College connection here. And then my other amazing Maryville College connection is Miss Meadow, who came and did work for me all summer. And I really have enjoyed doing the mentorship part that I also had no clue I'd be doing when I was a veterinarian. So thank you guys. Do you have any questions?
She's good at therapy.
What questions do you guys have?
So out of all the surgeries you do, what do you think is your favorite?
She knows the answer to this because I always joke about it. The reason I loved orthopedic surgery is my mom was the first surgeon in the Southeast that learned how to do the surgery that we do for ACL tears. And it's very different than what people have. They have replacements of their ACL, but we do a TPLO surgery, which changed the mechanics of the knee so that they don't need an ACL anymore. I love doing that surgery because it's like breathing to me. I do it so often. But I get excited when I do arthroscopy. So I really like to scope shoulders. And every once in a while I'll do some laparoscopy. So I really like that too. Anything else?
So how do you find motivation to go and stay in school for that amount of time? So I know a lot of students are interested in professional school.
Yeah.
However, to go on even beyond that, to do the postdocs, to do the residencies, where do you find that?
It was not enough for me to be a veterinarian. Being a veterinarian just in general was not what I wanted. So I knew going into it that I wanted to be a surgeon. I do think it's very important when you're considering doing that to make sure that's something that you really love and really want to do. I talk to vet students all the time about, hey, I'm thinking about doing an internship, or I'm thinking about doing a residency. And I'm like, would you be happy doing anything else? Because it is very, very hard. Internship and residencies are about 80 to 100-hour work weeks. And you get paid, it's a little nauseating. I think I calculated it once. I made like $3.50 an hour at that time when I was in internship and residency. But the look ahead and knowing what my life would be and the goal and trajectory of my life, it didn't feel hard while I was in it. I learned a lot, and you get excited about things along the way that you didn't think you'd be excited about. Yes?
How much research are you planning to do in the future, if any?
That is a great question. As I was finishing my residency, part of the reason that we have built the rehab program is that it's an excellent place to, it's good for our patients, but it's an excellent place to collect data. So our rehab program at Minnesota was actually where the pressure mats and all that thing came into play. And so I did have a strong intention of continuing to do research as I went. I have only been in practice 2 years, which feels like 20 years, but when you first finish your residency, you don't take your board exam until 6 months into practice. And so I studied for my boards and finished my boards, and then was doing the clinic renovations and hiring. And so that has kind of gotten pushed to the back burner. I think my goal is to first get my clinic running appropriately, and then I do hope to do some research in the future. When you are training residents, which I'm not doing that currently, you have to have a research program. And so maybe one day, if I have a resident, I need to have that prepared. Yes.
So one of the things that you mentioned that I would love for you to maybe reiterate to the students is your path was not this linear path where you said, I'm going to do this and then this and then this and then this. So for those that are in that position of going, I thought I wanted to, but what was your experience of sort of this opportunity came, it's not what I wanted, I mean, what counsel to those that see that and have anxiety over that, what would you offer?
I would say that so the first big change was going from I'm going to be a doctor to I'm going to be a veterinarian. And that change was very easy for me. And I can see how it's scary for other people. You guys are very young. I'm still very young. And even if I was right now, hey, I do not want to be a veterinarian, I would go and do a different schooling because you have a lot of working life left ahead of you. And there's no point in doing a job that you hate for your whole life. And so I think that was what gave me drive to kind of keep going and change and make that change, even though I'd been planning on something else. I also think when you are young, if there is an open door, you should walk through it and take it. Like I said, I did my first research project just because it was something I needed to take off a list, and it became something that I really loved. And so when I say walk through it, I mean walk through it and embrace it and enjoy it, and don't make it just a checkbox.
So you talked earlier about how biochem was a really helpful class for you. Were there any others, like specific classes that you took that you thought were really useful?
Oh my gosh.
Carry through to your practice?
Animal phys was like identical to freshman animal phys at vet school. Bacteriology, a lot of people very much struggled with that at UT, and I thought I struggled until I saw how much everybody else struggled, because it was not a complete repeat, but very close. I think is there still a histology class here? I didn't take that one, but I heard that it's very.
Crane does it as a part of FITS.
Yeah, I heard it's very similar to how it is. A girl in my vet school class was a year ahead of me here at Maryville, and she had taken that class and said it was pretty much identical. So a lot of the classes really, really do build, and I'm not kidding you guys. After you learn how to study and work and get through the curriculum at Maryville College, the curriculum, at least at vet school, is a lot of information, but it is not more difficult than what you're doing here. Anything else? All right, thank you so much for having me come. I really enjoyed it.